Now let us go to the management of the disease. Here you can see when you click management, here the list of diseases for which you can see the management have been given. Now you can select among this disease and it will tell you how to manage that particular disease. You can change the disease name and the new disease name will appear and its management will come in the text box. Now the treatment is given here. Now if you want to manage the accompanying symptom, then you can put the symptom name here and it will tell you the therapeutics for that particular symptom, the prognosis and the precautions to be taken in that particular disease. You can change it to any other disease, and if C also appears and you click here, then the therapeutics will tell you what is to be done in that particular case and what are not to be done. The prognosis of the case will appear and at the same time the precautions also. This will help you a lot in managing any particular case. Now we go to the investigation part. You have to put the disease name here, for example hepatitis B, and the software will tell you the test to be advised to the patient, and in blue you can see it will tell you if it is more what is the indication and if it's less what is your diagnosis. You can also see the differential diagnosis, the pathophysiology of that particular disease. Now, if you want to know about any laboratory test, for example, if you click alpha-fetoprotein, it will tell you the normal range, the indications, why alpha-fetoprotein is indicated, if it is high, what is the reason, if it is low, what is the diagnosis, and also pathophysiology can be read here. If you click in the See Also box, it will tell you the alpha-fetoprotein in the amniotic fluid, the normal range, the indication, the pathophysiology and the interpretation. Now if you scroll down you can see the list, and this is a case where you see, if you want to see the hemoglobin, it will tell you the different kinds of hemoglobin and related investigations to be done. In this case you can see the normal range for male and female. If it is high, what is the diagnosis, what can be the reason, and pathophysiology. Now we come to the reference chart. In this reference chart you can see this is a temperature pulse ratio, and if you go to the normal value of body fluid, it will tell you the normal value of blood, seminal fluid, stool, cerebrospinal fluid, sputum and urine. By clicking the appropriate label you can see, visualize the normal values of the body fluid. Now this nutrient contains in the food stuff. The category is cereals, and you can see the food, the Hindi name, the protein, fat, carbohydrates in grams, energy, calcium and iron in that particular food. You can change it here by clicking, and you can change to any other category. Say for example pulses and legumes. You can see the food here. You can click leafy vegetables. It will tell you the protein content, fat, carbohydrate, energy and calcium, iron in that particular food source. Now if you want to advise a diet to your diabetic patient, then the dietary algorithm allows in diabetes the daily diet for the diabetes patient, for a non-veg patient and for a vegetarian patient can be seen and taken as a printout. Division of the daily dietetic requirement. The meal for the non-vegetarian patient and the meal for the vegetarian patients have been listed here. Now, diet according to the type of the patient and the calorie requirement, the protein requirement, the fat requirement and the carbohydrate requirement have been listed here. In this food rich vitamins, you can see that the vitamin name and the description have been given here. And if you click for more details, the detail will appear wherein you can see that what is the daily requirement of a particular age group, male, female, and the information about that particular vitamin, the fruit source of that vitamin, the vegetable source of that vitamin, and the nut source of that vitamin. All the vitamins have been listed here for your easy perusal. Now this is iron rich food. You can see here the leafy vegetables, then the iron content in that particular leafy vegetable, the cereals, the flesh foods. Now this is calcium rich food, the name of the food, green leafy vegetables, the calcium, the cereals, pulses and fish milk and other products. This is height and weight chart for men and women, the desirable average weight and the obese weight.